Hi, my name is Latasha Easter, and I will be doing a health assessment on the cardiovascular, respiratory, and peripheral vascular systems. My patient today is Michael Freeman, and he will be assisting me throughout this process. So let's get started. Okay. I'm just kind of focus my camera on you for right now. Okay, so let's start off with a series of questions, your health history. And this is the respiratory portion. So, have you been having any shortness of breath?
No.
Any wheezing?
No.
What about a cough?
No.
Have you had any previous surgeries?
No.
Are you allergic to anything?
No.
Are your flu and pneumonia vaccinations up to date?
Yep.
Okay. Have you had any recent travel outside the U.S.?
No.
Do you use tobacco?
No.
Do you have exposure to secondhand smoke?
No.
Okay. Have you ever been diagnosed with asthma as a child?
No.
Do you have a family history of lung cancer?
No.
Okay, what about a family history of cystic fibrosis?
No.
Okay, so those are all my questions right now for your health history. So now let's go to inspection. Okay, I'm going to ask you to place your hands across your chest like so with your hands on your shoulders. Okay, and I'm just observing right now, and I'm going to observe on the side. Okay, you can place them down. Okay, can you take some deep breaths for me just so I can observe? Okay, got one more. It's good. Okay, good. All right. Yeah, there appears to be the movement in and out of your chest was symmetrical. There's no deformities noted. Your AP diameter appears to be more wider than deep, which is good. Your skin appears to be intact and appropriate for ethnicity. Okay, so let's go to palpation. What I'm actually do is just kind of turn around so the camera can see your back. Okay, so palpation, what I'm going to do first is just slightly palpate, starting above your scapula on both sides, all the way down to the bottom of your rib cage. And what I'm doing is checking for any nodules or masses or any tenderness. Did you have any tenderness to palpation?
No.
Okay. All right. And now what I'm going to do is do a check for your chest expansion. So what I'm going to do is take both hands, kind of couple them around like on your 10th rib and kind of create an area in between my thumbs. And what I want you to do is take a deep breath, inhale and exhale for me. Okay, all right, good. My fingers move equally as you did a deep inhale and exhale. Okay, and it was symmetrical on both sides. Now what I want to assess is your tactile phremitis. What I'm going to do now is place both hands on your back again, right above your scapula. Okay, and every time I place my hands, I want you to repeat the words 99. So
99. 99. 99. 99. 99. 99.
okay, all right. Phremitis was more prominent as I was going through your intercostal areas of your back compared to the lower portions of your posterior thorax, but that's normal. And they were equally on both sides. Okay, now what I'm going to do next is percussion. Okay, I'm just going to tap my hands. We'll kind of strike your back with my finger, okay, and I'm just checking for resonance. All right. Okay, and there was resonance as I was percussing your back. It was equally, it was a little dull below areas below the diaphragm, but that's normal. Okay, next, what I want to do is listen to your breath sounds. And for the purpose of the video, I only have to do the back. So every time I place my diaphragm on your back, can you just do a deep inhale and exhale for me, okay? Okay, perfect. Long sounds were clear equally bilaterally. Long sounds were vesicular. Okay. Now, one last thing I want to do. I'm gonna listen again, and as I place my diaphragm on your back, I want you to say the words E. Okay.
E. 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 E.
Okay. And what I was checking for there was egophony, and it was symmetrical on both sides. Every time you said the words EE, I did not hear any pronunciation of word A as I was auscultating, which could indicate areas of consolidation. So that was normal. Okay. All right, you can turn around. And this will conclude my respiratory exam. All right, now time for the cardiovascular portion of the exam. Let's start off with a health history. Okay. All right. I'm going to ask you a series of questions. Have you been having any chest pain?
No.
Any shortness of breath?
No.
What about a cough?
No.
Any fatigue?
No.
Any bluish discoloration to your skin?
No.
Okay. Do you smoke?
Nope.
Do you drink?
Nope.
Have you noticed any swelling in your arms or your legs?
No.
Okay, good. Have you ever been diagnosed with hypertension or high blood pressure?
No.
What about elevated cholesterol?
No.
Diabetes?
No.
Okay. Have you ever had any history of any heart problems that you know of, like a murmur?
Nope.
Okay. Any family history of coronary artery disease? Has anyone in your family suddenly died and they were under the age of 60? Okay. So that concludes our health history exam. Let's start with inspection. Okay. Just going to observe. All right. Off inspection, I do not notice any nervousness. Your skin appears to be appropriate for ethnicity. I don't see any cyanosis in your face or in your lips. I don't see any swelling in your arms or your legs. Okay. Now let's look at if you have any jugular venous distension. Okay. For the purpose of the exam, I'm going to have you at a 90-degree angle sitting upward. But if you're in a clinical setting, I would have you sitting in a 45-degree angle so I can fully assess properly. But, okay, let's look on both sides. Can you turn for me so I can just assess? Okay, observe. Okay, I don't notice any distension, okay, so that's good. Okay, now I'm going to look at your precordium. I don't notice any pulsations or any lifts there. Good. Okay, now let's go to palpation. I'm going to first palpate your carotid artery. Okay. Pulse appears to be 3+ there. Good. And I'm also going to now palpate over the 5 landmarks of your heart. Okay, I'm just going to name them out the first time, okay? And it'll be the same process when I'm listening to your heart as well, the same 5 areas. Okay, let's go on your right first, second, right second intercostal space, aortic valve, straight across, left second intercostal space, pulmonic valve. We'll go down to the left third intercostal space, and that's Erb's point. We'll go down again to the left fourth intercostal space, closer to your left sternal border. Okay, and that's your tricuspid valve. We'll go down to the left fifth intercostal space to your midclavicular line, and that's your mitral valve. All right, and then it's also going to be your point of maximum impulse, and that's actually non-palpable, but that's still good as long as it's not greater than 3 centimeters. Okay, so I've already given you the 5 landmarks. I've already palpated those areas. Now I'm going to listen to the same 5 areas with both my diaphragm and my bell. Okay, we listen to both sides because there are some heart sounds that we can't pick up with just one side, like a S3 or S4. Okay, and I'm listening. I've already given you the landmarks. suspension. Go back through with my bell. Okay. S1 and S2 are present. Alright, I didn't hear any S3, S4, any murmurs or rubs. Oh, I'm sorry, I forgot to auscultate your carotid artery. Sorry, I'm going backtracking. But I'm going to ask you as I do this if you could just hold your breath for me, okay? While I do this, I can properly hear. Okay, you may release. Okay, good. I didn't hear any bruit, so that's good. Alright. Okay. And that concludes our cardio portion of the exam. Alright, now time for the peripheral vascular system. Okay, this will be a quick one. Alright, so first I'm just going to inspect, okay, inspecting your skin and everything. I don't see any swelling in your arms or your legs. Your skin appears to be intact. I don't see any rashes or scars or anything. No ulcers, any pigmentation around your ankles. Okay. Alright, now let's do some palpation. Okay, let's first palpate your lymph nodes. I'm going to palpate your infraclavicular lymph nodes in a circular motion like this. Okay. Alright, now can you lift up your arms for me? Lift up both sides. I'm just going to palpate your axillary nodes. A circular motion. Okay. Now you're going to lift your arms out like this for me. Palpate your epitrochlear node in a circular motion. Okay, good. Your lymph nodes were non-palpable, so that's good. Okay. Your skin appears to be warm. Well, let's just take my glove off for the purpose of the video. Says it with the back of my hand. Warm, dry, and intact. Okay. Now I'm going to check. I already checked your carotid pulse. So now we just got to check your radial and your pedal pulses. Okay, I'm just going to do both sides bilaterally to compare at the same time. Good. Radial pulses are equally bilaterally. You're 3+. Let's check your capillary refill. Both sides. Okay, good. Capillary refill is less than 2 seconds on both sides. Now let's check your dorsalis pedis pulse. Let's try to get your feet in the video. Sorry. Okay. Able to be seen. Okay, can you hand me that one also? I have to check them both at the same time. Sorry. Good. Pulses are 3+ bilaterally. Cap refill. Okay. Good. Capillary refill is less than 2 seconds on both sides. Alright. Thank you. Okay. And that concludes our peripheral vascular system.